Hello, everyone. My name is Erica Parham. I am an intern at Atlanta Autism Center and also a graduate student at Georgia State University, currently receiving my master's in public health. Welcome again. Today, we are starting a journey focused on understanding and supporting families who are newly introduced to or recently diagnosed with autism spectrum disorder. Let's embark on this enlightening path together, ensuring we start strong with knowledge, compassion, and support. All right, folks, let's dive into what we'll be covering and discussing today. Firstly, we'll explore what is autism spectrum disorder to lay a solid foundation for our discussion. From there, we'll look at early warning signs and characteristics that can help us identify ASD early on. Understanding developmental milestones are also key, as these can guide us on important next steps. Next, we'll discuss the steps to diagnosis, which can be critical turning points for families. After diagnosis, we'll cover the next steps and services available to support you and your loved ones. This includes navigating care and support options, which can often feel overwhelming but are crucial for ongoing success. Finally, we'll wrap up with an overview of resources that can provide additional support and information. Remember, this is a journey, and having the right information and support is vital. Let's get started. All right, so the big question: autism. What is autism spectrum disorder? ASD is a developmental disability that affects how a child communicates, behaves, and interacts with others. People with ASD may show repetitive behaviors or have differences in speech and nonverbal communication, like gestures or eye contact. It's called a spectrum because each person's ability and challenges are unique and can vary widely. Some people with autism may learn or move in different ways or focus their attention differently. Early intervention, like getting support and therapy as soon as possible, can make a huge difference in helping children develop important skills. The goal is to help individuals with ASD reach their full potential and improve quality of life. Here's a slide of some early warning signs and key characteristics. We can go over the social communication and interaction characteristics, behavioral patterns, and other important challenges. So, with the social communication and interactions, kids with autism may avoid or not make eye contact at all. They have delays responding to their name. They may not show facial expressions such as being happy, sad, angry, or surprised. They also may use few or no gestures at all or share interests with others. They also may have that delayed language development and difficulty understanding other people's feelings. Some behavior patterns are restricted or repetitive behaviors or interests like flapping around, rocking back and forth, or spinning around and around. They may be a little hyperactive, impulsive, and inattentive behaviors. They may line up toys and other objects like cars or animals. They repeat words or phrases over and over again. They also may play with toys the same way every single time. They might even get upset by minor changes and have obsessive interests. And they must follow certain routines. Some other challenges we may see is GI issues, anxiety, stress, or excessive worry, a delayed or cognitive or learning skills, and inducing self harm. Here is some more information and links to just more information on the early warning signs and characteristics from the CDC, Autism Speaks, and National Autism Association. This chart shows important developmental milestones for children between 1 and 4 years old. Milestones are grouped into four main areas. The first area, social and emotional, how children interact and respond to others. The next area is language and communication, how they understand and use their words. The next area is cognitive, how they think, learn, and solve problems. And the last area is movement and physical development, how they move and use their bodies. At one, we should see children starting to play simple games like pat a cake. They understand no or say simple words like mama, dada, and can pull up to stand on their own or take a few steps. At two, they may begin to notice when others are hurt. They use about two-word phrases or kick and run. They also start using their hands together, such as holding objects or turning knobs. At 3, we may see children being able to calm down after short separations. They may be able to ask simple questions, yes or no questions, and join other children in play. They can also copy shapes like circles and put on clothes by themselves. And at 4, children may enjoy pretending to play with other kids, pretend play, as they say. They may use full sentences and change behavior depending on where they are or who they're with. They can also name colors and shapes, draw a person, and may even be able to unbutton or pour water with supervision. These milestones are only guidelines, not really strict rules. Of course, this is a spectrum, so each child develops at their own pace. And here are the developmental milestones in Spanish. All right, so here is the road to um, diagnosis, the diagnostic journey. So, with the initial consultation, this usually happens during a routine pediatric checkup. Doctors observe the child's behavior or ask parents about their behavior at home or during play. The goal is to identify early warning signs of autism. Some signs may appear early, but not all are required for diagnosis. During the evaluation, this is done by a specialist such as a developmental pediatrician, psychologist, speech or occupational therapist, or even a psychiatrist. This is done if the screening shows possible signs of autism. The evaluation focuses on social communication and behavior, language and thinking skills, emotional and adaptive behavior. And the diagnosis is only done by a specialist, and they're the only people that can make the official diagnosis. It is important for accessing support and services for families and the child. The diagnosis also helps distinguish autism from other conditions like ADHD, Fragile X, or sensory processing disorder. Also, as we said before, the characteristics of those diagnoses will be ongoing challenges in social communication, repetitive or restricted behaviors, and also early symptoms that affect learning and their daily life. Here's just some next steps of the post diagnosis and some things you may see during that time. We're going to go over applied behavior analysis, also known as ABA, my favorite, speech therapy, occupational therapy, also known as OT, and individualized education plan, also known as IEP. The applied behavior analysis, also known as ABA, is an evidence based therapy proven effective in improving specific behaviors. It focuses on creating meaningful and lasting behavior change. ABA helps improve social skills, communication, reading, daily living and hygiene skills, motor skills, and even visual performance tasks. The goal of ABA is to increase desirable behaviors like communication and cooperation, while also decreasing undesirable behaviors such as aggression or self injury. ABA can be done in homes, schools, clinics, or even the workplace. ABA is the most effective when individualized to each person's needs and applied consistently across different environments. Here's a slide from the Council of Autism Service Providers. Just some evidence about ABA treatment for young children with autism and the impact of treatment intensity on outcomes. So here are some things that are bolded and just very important with ABA treatment. Start the treatment as soon as possible. Developmental gaps grow bigger over time. ABA therapy should average 3 to 40 hours per week. Treatment should help your child become an independent learner. Treatment should help improve your child's ability to function effectively in every critical environment like home, school, and the community. Your child's care should be individualized and delivered with the compassionate understanding of your child's and family's preference, strengths, and needs. Speech therapy is a common part of intensive autism treatment programs and helps with both verbal and nonverbal communication. Therapy is customized for each child by evaluation by speech language pathologists. There's a focus on speech mechanics, how sounds are made, social use of language using language in conversations, and understanding verbal and nonverbal cues like tones and gestures. Often the goal is improving spoken language skills and developing nonverbal communication, such as signs and gestures, as stated before. Therapy can be delivered in different formats, such as one on one sessions, small groups, and classroom settings. Here we have occupational therapy, also known as OT. Occupational therapy helps children improve cognitive, physical, and motor skills. The goals of OT is to promote independence and enable full participation in daily life. OT begins with an evaluation by a certified occupational therapist assessing developmental levels, learning styles, social abilities, and even environmental needs. The therapy often targets the play and leisure skills of the child and also the learning and self care skills they may have or want to develop. The common daily goals of OT includes independent dressing, feeding, grooming, and even toileting. It also helps to improve social and fine motor skills as well as visual perceptual skills. And then we'll lead into the individualized education plan, also known as IEP. An IEP is a written plan designed to meet a child's unique educational needs and is required for all children receiving special education services. That is very important to remember. The purpose of an IEP is to set reasonable learning goals for the child, and it outlines the services and supports that the school will provide. IEPs are developed by the parents, the key school staff, and all the specialists that we have talked about before. An IEP, it is included the current performance of the child, the annual goals, special education and related services, the placement information, assessment participation, service details like the start dates, the frequency of the sessions, the location, and the duration, and also the progress tracking. IEPs are developed within 30 days after eligibility is determined and are reviewed at least once a year to update the child's goals and services. And we've reached to the point where we talk about navigating care and support options. Know that you are not alone in this process. There are families that are going through this each and every day, and this will just give you just a better understanding and a little push so that you know that you'll be successful with you and your child on this ABA journey, this autism journey. I'm sorry. So, navigating care and support. Contact your state's early intervention program, autism centers, and school special education offices as early as possible. Ask your doctor for referrals. Check insurance coverage for your services. Learn about different therapies and supports in your community and outside of your community. Track and understand your child's daily progress. Stay in touch with your child's RBT, BCBA, and the clinical directors. Join local parent and child support groups, and also practice regular self care for the whole entire family, not just the child. And just an overview of what we've discussed here today. Autism spectrum disorder, also known as ASD, is a developmental disability. It may impact the social communication and behavior skills and challenges within children, and early signs can be seen before the age of 3. There is no blood test to find autism, which makes it kind of hard to diagnose. Doctors look at the child's how they behave and how they've grown and learned. The diagnosis is based on patterns of development and behavior, not lab results. Treatment and therapy can help to reduce symptoms that affect daily life. The goal, of course, is to improve the child's quality of life. The treatment categories include educational, behavioral, developmental, social relational, and psychological. Children with autism have their own strengths and challenges, just like us all. At the Atlanta Autism Center, treatment plans are multidisciplinary. Parents are actively involved in their child's therapy. Each plan is made to fit the child's individual needs. And thank you. Thank you for your attention. Atlanta Autism Center focuses on to advocate, educate, love, and accept. Here are all of our offices hoping that you give us a call and start your journey today. Thank you so much.